Oral Janus kinase, SYK inhibition, ASN002, suppresses inflammation and improves epidermal barrier markers in patients with atopic dermatitis. Authors: Anna B. Pavel, Teresa Song, Yunja Kim, Esther Del Duca, James G. Kruger, Celina Dubin, Xiangyu Peng, Wei Xu, Ning Zhang, Yariel D. Estrada, Louis Dennis, Niranjan Rao, Sandeep Gupta, David J. Zammit, Robert Bissonette, and Emma Gutman-Yaski. Department of Dermatology, Laboratory of Inflammatory Skin Diseases, Icahn School of Medicine at Mount Sinai, New York, NY. Background: moderate to severe atopic dermatitis, AD, has been associated with significant disease burden and systemic abnormalities and often requires systemic treatments. Currently, safe and effective oral systemic treatments for moderate to severe AD are not yet available. ASN002 is an oral inhibitor of the Janus kinase, spleen tyrosine kinase signaling pathways, targeting several cytokine axes, T2, T22, T17, T1, and epidermal differentiation. Objective: we sought to evaluate the effect of ASN002 on the cellular and molecular biomarker profile of patients with moderate to severe AD and to correlate changes in biomarkers to improvements in clinical severity measures in pruritus. Methods: 36 patients with moderate to severe AD were randomized to groups with dose escalation of ASN002, 20, 40, and 80 mg, and a placebo group. Skin biopsy specimens were performed at baseline, day 15, and day 29. Gene expression studies were conducted by using microarray and quantitative RT-PCR, and cellular infiltrates and protein expression were studied by using immunohistochemistry. Results: ASN002 reversed the lesional skin transcriptome toward a non-lesional phenotype. It also rapidly and significantly suppressed key inflammatory pathways implicated in AD pathogenesis, including T2, IL-4 receptor, IL-4R, IL-13, CCL13, monocyte chemoattractant protein 4, CCL17, thymus and activation-regulated chemokine, CCL18, pulmonary and activation-regulated chemokine, CCL22, macrophage-derived chemokine, and CCL26, EOTAXIN3, T17, T22, LIP. Ocalins, PI3, Elefin, CCL20, S100A7, S100A8, S100A9, and IL36G, IL36RN, and T1, IFNG, CXCL9, CXCL11, and MX1, axis and barrier-related measures, filigran, FLG, and CLDN23. Significant improvements in AD gene signatures were observed predominantly in the 40 and 80 mg groups. Smaller and largely non-significant molecular changes were seen in the 20 mg and placebo groups. Conclusion: the Janus kinase, spleen tyrosine kinase inhibitor ASN002 significantly suppressed key AD inflammatory pathways, corresponding to clinical response. ASN002 might be an effective novel therapeutic agent for moderate to severe AD.